fibrodysplasia ossificans progressiva, or FOP, is such a devastating disease that many secondary problems may arise. To manage this properly and on time, a multidisciplinary team is needed where all specialists are well aware of the rare disease and are dedicated to work together to help the FOP patients. Such a collaboration is created by working transparently with like-minded colleagues. Also, this takes time. It gives such job satisfaction to achieve the best care for and together with the FOP patient. For this, you need frequent contact, consultation with the patient is very important to achieve the best personalized therapy and innovative solutions in issues that previously seem unsolvable. My name is Marliese Eekhoff. I'm internist endocrinologist at the Amsterdam UMC. I'm dedicated to FOP since 2011. Also trained in the field of rare bone diseases. The first FOP patient I met at the Amsterdam UMC and caught my eye immediately. While the patients were sometimes completely trapped in a second skeleton, their struggle, energy to life, active mind and sense of humor were impressive to me. Two research models have been developed in Amsterdam, one using a very small skin biopsy and the other using ligaments of teeth that remain after extraction of medical reasons. This allows to set up and investigate osteogenic transdifferentiation in cell cultures, thereby providing more insight in the disease and supporting opportunities to find new therapies.
I'm an anesthesiologist here at the Amsterdam UMC Bone Center, and I'm involved with FOP patients as an anesthesiologist in the entire trajectory of beginning of care up to, if needed, surgery. Together with two other colleagues, we treat many patients from the Netherlands and also internationally from many countries in and around Europe. Young people, elderly, children, we see all types of demographics. It's a varied group. There's also a lot of variance in the severity of disease, from very mild to very severe cases, and we see the entire spectrum. There are certain difficulties that we see in these patients. Also, very restrictive pulmonary function can be seen, especially in severe cases, and even so severe that mechanical ventilation is not possible at all. In these cases, general anesthesia we usually try to avoid. As a team, most importantly for any surgery in these patients is that you need to approach it as a multidisciplinary team. So we evaluate these patients long before the surgery is planned, if possible, with the entire team. We also see the patients themselves. Most of them we already know, and the ones that we don't know we want to see before the day of surgery, just to see what is possible, what isn't possible. We try to assess if we want to perform a regional technique. We try to assess if it is possible at all. So we always use the ultrasound on forehand just to identify the nerves to see if it's possible at all to perform a regional technique. It's a joy to work in this team because it's a team made up of all types of specialists that are really enthusiastic about providing the best of care for these patients. It's a varied group with all types of inputs, all types of different perspectives, and I think that as a team we do our utmost best to make the best possible for these patients. And in the years we've gotten to know a lot of these patients as well because we see them regularly for all types of checkups or procedures, and yeah, we just want to do the best for them. Treating these patients takes time. You can't rush it, because if you try to rush it, then things go wrong. So you need to take your time, be patient, and then usually that's the best. So there's something very strange about the FOP patient, because even though they have a very severe illness, that most clinicians that I speak to, you think that having a disease this severe would make you a bit pessimistic about life, but for some reason they are the exact opposite. They are really positive, and even though they are, if you just look at the disease itself, they are very ill. They have very much discomfort, but for some reason they still keep positive about it. And I think that's a good example for ourselves as well. Well, the problem with needles with these patients is that all kinds of trauma can be a cause of ectopic bone formation, especially needles that go through a lot of tissue, connective tissue, muscles. So in any case, you always want to avoid it if possible. Sometimes for anesthesia, it's unavoidable. Then it's something that has to be done, but with a lot of precautions.
In collaboration with the Imaging Center of Amsterdam, UMC, the use of 18F sodium fluoride PET-CT was investigated in FOP, with which we found that we can use it to see whether a flare-up will lead to HO later on, which is not the case in about 20% of the patients where flare-ups solve without any bone formation. The labeled fluor only binds to active bone formation sites through an exchange with the newly formed matrix. And in this way, it's able to detect and quantify the activity of the ossifying flare-up even before you can see any bone on the CT. So this imaging modality is able to be used as a marker for disease activity. We not only show that you can predict where a flare-up will form bone in the future or in a few weeks later, but also we found that there is also a chronic phase of the disease. Nearly all patients have chronic activity of the disease, and with the 18F sodium fluoride PET-CT, we can find these spots and see how active they are.
In the beginning, being a surgeon in a FOP team was a bit strange because surgery in FOP patients usually is a no-go area. But because we see so many patients, we found that in extreme cases where infections, hygienic problems or severe deformities have no other options besides surgery, the treatment plan that we can offer is becoming more diverse, and with the help of all the research that we do, I think it can become even more patient-centered in the future. So working in a university hospital, we have a big research department, we have a clinical department, and we have a collaboration with several pharmaceutical companies, and that allows the entire team to offer a patient-centered and patient-tailored treatment plan. In my opinion, surgery is the way to go in the future, and I think the quality of life of FOP patients can dramatically be improved if we can suppress the heterotopic ossification flare-ups.
We always work in a team with the imaging radiologists and nuclear specialists, and are involved with not only with preparation of the patients for the PET-CT, as you can see here, but also we look together to the pictures to really understand what is happening so we can help the patients as good as possible.
Being close to a large airport, Amsterdam is in Europe a very, very central position, and we see a lot of FOP patients from this area. We are an international referral center, and that makes our team more and more experienced because we see so many different patients with a lot of different issues.
We are ready to help them. If they can't, they can always call, or we can have a video consultation, but coming is also possible.